Dr. Christine Forrest is a Los Angeles-based psychiatrist. She's seen firsthand how effective animal-assisted therapy is. With her is her trained therapy dog, River, happiest animal on the planet right now. Dr. Forrest will tell you patients have benefited from River's participation in her practice in profound and remarkable ways. We'll get to that in just a bit. Dr. Amber Anderson is the medical director and owner of Redondo Veterinary Medical Center. She's also joining us. She's seen countless examples of how the human-animal bond enriches health and heart, both among common house pets and some surprising exotic animals as well. We want to welcome all of you to Full Frame. Thanks so much for coming in. Christine, why don't I start with you? So you're in practice for 12 years, but River's only been with you for 2. What made you say, you know what, I'm going to bring this dog into the office and see what happens?
When I was in training, my residency training at County USC, one of my mentors had a Labrador, and she brought him to her office. She was working a lot with children at that time, and that was 20 years ago when working with dogs was not considered cool. It was she was doing revolutionary stuff, and she kind of paved the way and made me very curious about that. And she was having amazing stories about how children and the parents were reacting to the dog and how pacifying everything was when the dog was in a room. So ever since I had this idea in mind, but it wasn't possible for us to get a dog until 2-3 years ago. And I thought, like everybody else, okay, the dog is going to come and it's going to be nice and people are going to be relaxed. And I had the usual concerns like allergies and health concerns and how clean he has to be, but I had no idea the impact that actually he has on the therapy itself. And that's what animal-assisted therapy, by definition, is when the animal is not only present, but it's engaged in a therapeutic process, in psychotherapy session itself. And at first I realized that when the dog was there, they were more open. They would bring up more intimate concerns than before. It was like a barrier was shattered, and we're all together trying to find the best way possible for them to get well.
And I'm sure, Amber, when you hear stories like Christine's,
Not unusual.
It's not unusual, is it?
It's not, and you know, I find that the human-animal bond is really a unique and sacred bond, and you know, we've relied on animals since the beginning of time for transportation and food and clothing, and now we're really beginning to find the significant benefits that they have on the emotional, the psychological, and the physical health of people.
And you look at the two of you, and this dog's got to be the happiest animal on the planet. I was just getting petted. Yeah, and you. Well, that's the point, though, isn't it?
I mean, too.
Yeah, and that is that what you saw initially? Was just that suddenly people they're starting to relax a little bit more, and they're more open. They're petting the dog. Is that the initial stage?
That's what happened. But in the beginning, one of our first cases was this new patient with post-traumatic stress disorder. She was a young lady. Horrible things have happened to her. And she was so traumatized that every time I would ask her a question about the trauma, because that's how we process something bad that happened to us, by talking and bring it from the subconscious into the conscious field of awareness. She couldn't talk about the trauma. River was positioned in her lap, and every question I would answer, the answers will go straight to River. And River understood that he was there for a purpose, and for the whole hour would not move. He knew he had a job. So that impressed me. How did he know that? How come this person so traumatized was comfortable talking to him? How come the barriers between judgment and shame and emotional pain were not there?